What's going on, world? Welcome, welcome, welcome. Hey, I know somebody's going to say, like, Kev, you're tardy today. I'm going to be like, first of all, it's Friday. So first of all, get a step back. You already know what the deal is. You already know what we're doing. We're doing NCLEX questions. Hey, we do these questions every Monday, Wednesday, and Friday at 5:30 for now. Because I'm telling you right now, that's going to change. But of course, y'all already know that we are not going anywhere and doing anything until I get 1,000 likes and I get 100 people in here. So what are we really doing? You know what I'm saying? So you already know the deal. I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse here rocking with us, what are you doing here? All right. I am Kevin, your gracious host that everybody loves the most. I should probably start making that, your host you love the most. But make sure you guys like, you guys share, you guys follow. That's the trifecta that gets in front of the For You page. Y'all may not want to be in front of people, but your boy does. Megan says, I'm in my second semester. Shout out to you, Megan. What else? Who else is up in here? Savannah, you passed your NCLEX #1 today. Congratulations, Savannah. Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. Is it Yamville? Shout out to Yamville. I got 2 in a row. Shout out to you. Congratulations to Savannah and Yamville for passing their NCLEX. Welcome to the greatest shit show on earth, known as being a nurse. Hey, I want to know, if you have a piece of advice, what advice would you give to everybody? I need everybody to give them love right now. Grace, I see you out there, Miss Lady. How are you? Hey, we're at 360 likes, 75 people. Obviously, y'all don't want no questions today. Y'all think I'm playing? I'll just sit here and run my mouth for however long. I'm just saying, so share it, follow it, make it happen. You know what I'm saying? Miss Valletta, how are you? Johnny 666, I see you, Johnny. I see you. Use Archer is similar to NCLEX. That's cool. I like that. I like Archer. I think Archer's cool. We got 100 folks up in here. It says, how do I get in? How you get into what? How do you get into what? I'm going to need for you to be more elaborate, because you can get into trouble, you already know, great, almost NCLEX time. I know that's right. What's up, Chan? How are you? Hey, we got 130 people up in here. We got 1,000 likes. You already know what to do. We're doing. Here we go. Hold on, let me fix this because obviously it looks messy. But ladies and gentlemen, we are doing NCLEX questions. So shout out to y'all. We do these Monday, Wednesday, Friday at 5:30. And without further ado, so I can fix myself, because obviously I am wrong for not being prepared like this, but whatevs. And ladies and gentlemen, give me 1 second. Here we go. All right, here we go. A 43-year-old African-American male is admitted with sickle cell anemia. The nurse plans to assess circulation in the lower extremities every 2 hours. Which of the following outcome criteria would the nurse use? Is it a body temperature of 99 degrees Fahrenheit or less? Toes moved in active range of motion, sensation reported when soles of feet are touched, or capillary refill is less than 30 seconds. What are we thinking? What is NCLEX? The NCLEX is the nursing licensure exam for both registered nurses and licensed practical nurses. So that is the exam they need to pass in order for them to practice as a nurse. So what are we thinking? Shout out to all 300 plus of y'all. Christina, you passed your NCLEX. Shout out to you. Shout out to you, Christina. Welcome to the greatest shit show on earth, known as being a nurse. If you have a piece of advice to tell everybody, what advice would that be? Y'all give Christina her love. You're number 3 today. You're number 3 in the last 2 minutes. So shout out to you. All right, y'all. Here we go. In 3, 2. And the answer is D. It is capillary refill less than 3 seconds. It is important to assess the extremities for blood vessel occlusion in the client with sickle cell anemia, because a change in cap refill would indicate a change in circulation that is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. Hey, there are 4 large sections. 4 large sections. All right, management of care, pharm, physiological adaptation, and reduction of risk potential. So shout out to y'all for getting that answer right. What's up, Cass? Hey, if you guys don't know who Nurse Cass is, she works correction. She's been doing that almost 20 years, and she fights motherfuckers. So I'm just letting y'all know. Question number 2, a 30-year-old male from Haiti is brought to the emergency department in the sickle cell crisis. What is the best position for this client? What is the best position for this client? Is it sideline with knees flexed, knee to chest, high fowlers with knee flexed, or semi-fowlers with knee extended on the bed? What are we thinking? Shout out to all 290 of y'all that are rocking with me. By the way, I got these questions off nurseslabs.com. They are free sets of questions. Go over there and check them out for yourself. Also, if you are a nursing student in nursing school right now, and you haven't shared this to everybody that you're in school with, first of all, you're wrong. And second of all, I need for you to fix yourself. So I know y'all are in Cahoots or whatever little app y'all are in. I don't care how you feel about them. I'm going to need for you to share it. All right. So stop playing games with me. Stop playing with yourself. Pause. You know what I'm talking about. And get it out there. Stop being greedy. You can't have me all to yourself. It's weird. All right. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is D. Semi-Fowlers with legs extended on the bed. All right. Placing the client in semi-Fowler's position provides the best oxygenation for this client. Marissa, thank you for the heart. I appreciate you, Miss Lady. Do you do TEAS exams? I do not. If you want to know about TEAS, I would check out my girl, the nurse Sam. She actually does TEAS Tuesdays. All right. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17% on the NCLEX exam. All right. So, hey, so some of these questions are not going to have so many rationales that are in depth. All right. So that's where you guys have to go and you guys have to put in the work and do and look up those answers yourself. Isaiah says, Isaiah, sorry, I took my NCLEX yesterday and wanted to thank you for your lives. Isaiah, you are very welcome. I like to do these lives, even though I'm probably going to go down to twice a week. I passed my NCLEX yesterday. Shout out to you. You're number 4 today. Congratulations. Welcome. Wait, what was your name again? Let me see what your name is. My mom's here. Hi, Sarah. Hey, everybody. Hey, if you ever want to learn about business or mentorship, SSH mentoring, that's your lady right there. Is it Nai87? Congratulations to you. Welcome to the greatest shit show on earth, known as being a nurse. I need a piece of advice from you. You can't come here and take and not give. You know what I'm saying? So here we go. Question number 3. A 25-year-old is admitted in sickle cell crisis. Which of the following interventions would be the highest priority for this client? Would it be take hourly blood pressures with mechanical cuff, encourage fluid intake of at least 200 mLs per hour, position in high Fowlers with knees gatched raised, or administer Tylenol as ordered? We got a bunch of D's. We got a bunch of C's. All right. Shout out to all 300 plus y'all rocking. Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us? All right. Here we go. Here is our answer in 3, 2, and the answer is B. Encourage fluid intake of at least 200 mLs an hour. It's important to keep the client in sickle cell crisis hydrated to prevent further sickling of the blood. That is part of physiological adaptation. Shout out to Memphis. Physiological adaptation, 11 to 17% on the NCLEX exam. That is the third largest section, ladies and gentlemen. Section number 3 largest. There are 8 client need sections of the NCLEX, and that's part of the big 3. All right. So shout out to who is that? Bree, Miss Bree. I see you out there. Shout out to ICU. All right. Hey, by the way, if I don't have 10,000 likes by the time I get to the 10th question, I'm boycotting the rest of these questions. Try me if you want to. Here we go. Question number 4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? Would it be peaches, cottage cheese, which is disgusting, popsicles, or lima beans? What are we thinking? What are we thinking? Hey, quick little note about me. I've been a nurse for 3.5 years. I almost forgot. I've been a nurse for 3.5 years. I've worked in a burn ICU, a medical ICU, as well as I've worked in the PACU, as well as the operating room. And yeah, so that's just a little bit about me. We'll talk a little bit more about that. Hydration for sickle cell. There you go. All right, here we go. Here's our answer. Here's our answer. ER nurses rock. ER nurses, all right. They fine. Whatever. I'm just playing. I love ER nurses. They're cool. I got a lot of friends that are ER nurses. So here we go. Question answer is C. Popsicle? Hydration is important in the client with sickle cell disease to prevent thrombus formation. Popsicles, gelatin juice, and puddings have high fluid content. That is part of basic care and comfort. Basic care and comfort. All right. We are the best. What are y'all, DJ Khaled now? Come on now. We the best. Basic care and comfort is 6 to 12% on the NCLEX exam. Shelby, speak it into existence. Future NICU nurse. That's what I like to hear. Here we go. Is it Chris? And I'm guessing that's short for Crystal. So, hey, you know what the deal is. DJ Khaled said, we the best. Question number 5. A newly admitted client has a sickle cell crisis. The nurse is planning care based on the assessment of the client. The client is complaining of severe pain in his feet and hands. The pulse ox is 92. Which of the following interventions would be implemented first? All right. So assume there are orders for each intervention. So do I want to adjust the room temp, IV bolus, give a bolus of IV fluids, O2, or do I want to give Demerol 75 milligrams IV push? What are we thinking? Shout out to all 380 some of y'all that are in here rocking with me. Hey, if you guys haven't, make sure you guys like, share, and follow. If y'all don't like and y'all don't share and y'all don't follow, what are y'all doing? Y'all just coming here and taking and not giving? Come on. Don't do me like that. Do it because you love me. You know what I'm saying? Don't be greedy out there. Don't be greedy. All right. And like I said, hey, if you're new here, I want to know who you are, where you're from. Pam, thank you for the heart. I appreciate you. I want to know who you are, where you're from, and where you're at in your nursing journey. I want to start them on O2 because it's a priority. Okay. Is it Sierra? Because your A is really, that A is huge. So, but anyways, and you are correct, ma'am. That answer is C, start O2. The most prominent clinical manifestation of sickle cell crisis is pain. However, the O2 indicates that the oxygen levels are low. Thus, oxygenation takes precedence over pain relief. Hey, ain't nobody ever died from pain. I'm just saying. I appreciate you, Cass. You already know I appreciate you. Hey, physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. LPN and ICU taking the NCLEX RN. Shout out to you. Is it Paxton? So shout out to you. Oh my God, I was thinking C. Did you pick C though? There's a big difference between picking and then actually, thinking and then picking. If you didn't pick it, that answer is wrong. I'm just saying, hey, real quick, I got some test taking tips. You guys can go over there and check them out. They are in my bio. You can check it out. It's the, if you click my little face up here, it'll show you that. Or you guys can go to thebootnurse.com/test. If you don't own a fanny pack, what are you really doing with your life? Because shout out to the fanny packs. If I had a Gucci one, you already know what the deal is. But go over there and check it out. That's 42 pages of just absolute delicious, buttery goodness. You know what I'm saying? Here we go. Question number 6. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? All right. So is it roast beef, gelatin salad, green beans, and peach pie? I don't know why that peach pie sounds so good. Anyways, chicken salad sandwich. Was it coleslaw, french fries, and ice cream? Egg salad on wheat bread, carrot sticks, lettuce salad, and raisin pie. What the hell is a raisin pie? Pork chops, cream potatoes, corn, or coconut cake. What are we thinking? What are we thinking? Shout out to all y'all. Get me to 10,000 likes. I think y'all got tired. So now we on the road to 20,000 likes. Let's make that happen. All right. Hey, if you're new here, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. Also, if you're a nursing student in school right now, I'm telling you right now, they got nursing care plans over there, and those nursing care plans will save your life. All right. I'm just saying, go over there, check them out for yourself. But the answer is C. It's egg salad on wheat bread. Right? Carrot sticks, lettuce, salad, and raisin pie. All right. So egg yolks, wheat bread, carrots, raisins, and green leafy vegetables are all high in iron, which is an important mineral for this client. That's part of basic care and comfort. Basic care and comfort, which is 6 to 12% on the NCLEX exam. She says, like I said, ED nurses are the best. Ain't nobody say nothing about them not being the best. God, that raisin pie. Hey, somebody let me know if raisin pie is good, because that sounds not good. It doesn't sound delicious at all. So here we go. Shout out to everybody that got that question right. Make sure you guys keep liking, you guys share, and you guys follow. Here we go. Hey, when we get to question 10, I'll tell you a little something else about me for those that don't know. Question number 7. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A family vacation to the Rocky Mountains, chaperoning the local boys club on a snow skiing trip, traveling by plane for business trips, or a business trip to the Museum of Natural History. I'm not even gonna lie to you, that last one, if you've been to the one in New York City, it's fire. Like, I'm a huge nerd for stuff like that. So that and the Bodies exhibit. If you've never been to the Bodies exhibit, like the one that was in Vegas or the traveling one, you gotta go. You gots to go. All right, what are we thinking? I'll give you guys 10 seconds. We got A, we got D. It was on Archer too. I'm pretty sure. I was going to say A or B. Well, is it Clea or Clea? Tell me which one. Give me one. Higher altitude needs more oxygen. Look at you. The Bodies exhibit is awesome. Damn right it is. All right, altitude sickness. Y'all some smarty pants as I heard. Okay, all right. Here we go. Let's see what the answer is in 3, 2. And the answer is D. A bus trip to the Museum of Natural History. Taking a trip to is the only answer that does not pose a threat. It does not pose a threat. Now, A, B, and C. This is where I tell you guys. This is where I tell you RTFQ. You got to read the effing question. Read the effing question. Yeah, you go, oh my God, I read that question wrong. Look at that. RTFQ, read the fucking question. Hey, don't get me banned. Y'all already know what it is. Stop playing games. If you read the question wrong, you will get it wrong. That is why it's important that you read it. And then guess what? When you get to your rationale, you can be like, oh, damn, what happened? My biggest issue? Well, we're going to fix that issue right now. We're going to fix that issue right now. You better start reading the question. All of it. Shout out to all y'all. Here we go. Question number 8. The nurse is conducting an admission assessment of a client with vitamin B deficiency. Thank you for the heart. Is it peach to love or peace to love? I heard peach and I called you peach. My bad. Peace to love. I appreciate you. Which of the following would the nurse include in the physical assessment? Is it palpate the spleen, take the blood pressure, examine the feet for petechiae, or examine the tongue? What are we thinking? Shout out to y'all. You already know you my dude. Cass, what you talking about? Props and congratulations for all. I appreciate you, Cass. You already know the deal. You know how I appreciate you, Miss Lady. Here we go. Give you guys 10 more seconds. Hey, also, if you guys are new here, make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. That is the trifecta for me to get in front of people that don't want me in front of them, but I'm going to be in front of them anyway. All right. Red beefy tongue. I see y'all. Say a bunch of y'all said that. Thank you guys for the follows. Appreciate you. Here we go. Here's our answer in 3, 2. And the answer is D. Examine that tongue gooey or that tongue, whatever. The tongue is smooth and beefy red in the client with vitamin B12 deficiency. So examining the tongue would be included in the physical assessment. That's part of physiological adaptation. All right, physiological adaptation, which is 11 to 17% on the NCLEX and the third largest section on the NCLEX as well. Okay, so shout out to everybody that got that question right. Remember, y'all need content Q&A with your rationale so you can review them. And guess what? If you get the question wrong, take that ass right back to the beginning and go through your content so you can understand why you got it wrong. You need to be able to acquire the knowledge, apply it to a question, and then you need to be able to retain it when you do your rationale. All right. Hey, nothing but goodness around here. What's the largest? The largest section on NCLEX is management of care, which is 18 to 23% or 18 to 21. Doesn't matter. Still the largest section. Do I do NCLEX reviews every day? I do not. I do them 3 times a week, Monday, Wednesday, Friday. Question number 9, an African-American female comes to the outpatient clinic. The physician suspects vitamin B12 deficiency anemia. Because jaundice is often a clinical manifestation of this anemia, what body part would be the best indicator? Is it the conjunctiva of the eyes, soles of the feet, roof of the mouth, or shins? Girl, you got some yellow ass shins. No, I'm just playing. Start calling all y'all yellow shins. Come here, yellow shins. It's the eyes. Are you sure? Conjunctiva is pale. Okay. Stephanie, I'm sorry. You already know it says yellow eyes. Hey, whoa. Nadia, whoa. You got to be nice out there. You got to be nice. Shout out to all 700 plus y'all out here rocking with me. We're doing NCLEX questions. Make sure you guys like, share, and follow. If you don't, I will find you. I'll find you. Trust and believe me. It says yellow shins, the pirate. Stop it. Not the yellow shins. You already know what the deal is. Hey, not the emoji with the yellow leg. Shout out to y'all. Here we go. Here's our answer in 3, 2. And the answer is C, roof of the mouth. The oral mucosa and hard palate, roof of the mouth, are the best indicators of jaundice in dark-skinned persons. You folks that got lots of melanins, you folks that got all the melanins, yeah, that's what it is. That's what it is. Part of health promotion and maintenance, which is also 6 to 12%. You can have your money. What you mean? 6 to 12% on the NCLEX exam. All right, 6 to 12%. This is why it's so important that you read your rationales. So important that you read. And guess what? If you don't get it right, where are you going? You got to go back to the content to find it. Whether you agree with it or not, I don't care. You got to go back to the MedSearch book and go look and tell me what the answer is. It says dark-skinned. That sounds so racist, David. It does. Here we go. Question number 10. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Is it a BP of 146 over 88, respirations of 28 and shallow, weight gain 10 pounds in 6 months, or pink complexion? What are we thinking? By the way, some of these questions are just not going to make sense. And some of them are going to be, some of them are going to be wrong. However, if I was to give you 100 questions and there was 8 of them that are wrong, guess what? there should be no reason why you should still fail that exam. You see what I'm saying? And remember, your NCLEX is computer adaptive. You're not going to agree with everything. You're not going to agree with it all. The whole thing is you need to know what everybody else knows. You don't have to ace this exam. So I don't know what they tell you. I don't know what they tell you. All right, here we go. But here's our answer. Our answer is B. Respirations 28 and shallow. When there are fewer red blood cells, there is less hemoglobin and less oxygen. Therefore, this client is often short of breath. There you go. Physiological adaptation. Third largest section on the NCLEX at 11 to 17%. So shout out to everybody that got that right. Remember, you have to read your rationales. Is it Cardi? Cardi says, let's go. Let's go. It says, can you show A again and explain? No, I cannot, because on NCLEX you can't go back. So we're going to go forward.